Hi, my name is Judy. I'm from Henry Ford Hospital's Infectious Disease Department, and I'm here today to talk to you about better managing your high blood pressure with lifestyle change, medication, and working with your doctor. High blood pressure is unfortunately, it's a very common health problem in the U.S. Almost half of all adults have hypertension or high blood pressure. Hypertension is definitely more common as we grow older, and in the U.S., for example, high blood pressure is present in 76% of adults between the ages of 65 and 74, and up to as high as 82% of adults 75 years and older. So, as you can tell, high blood pressure increases with age. Unfortunately, many people's blood pressure is not well controlled. According to the American Heart Association, if you have high blood pressure, you are not alone. Nearly half of American adults have high blood pressure, and unfortunately, many do not know that they have it. The best way to know if you have high blood pressure, as a matter of fact, the only way to know, is if you get it checked. So many times we don't know the exact cause for high blood pressure. The bad news is that high blood pressure can lurk in the background and can cause a significant amount of damage in our body, and we don't even realize that it's going on. Some risk factors that are out of our control, we really can't change, is getting older, for example, or our race. But the really good news is that there are many ways that we can control our blood pressure, and that's what I'm here to talk about today. So according to the American Heart Association, normal blood pressure ranges from less than 120 systolic to less than 80 diastolic, and each range going down this color chart depicts more and more elevated blood pressure readings and more problematic readings. So, did you know that the rate of heart attacks go up as your blood pressure goes up? Another really critical point to remember is that high blood pressure is the leading modifiable, meaning that you can have some control over it, risk for stroke. As a matter of fact, high blood pressure causes half of all strokes. And I can tell you from my experience in the emergency room, strokes can be very devastating and, as a matter of fact, can kill people. And I think we all, unfortunately, know people that have been affected by a stroke. Another condition that is tied to high blood pressure is heart failure in both men and women. According to the American Heart Association, 91% of all newly diagnosed heart failure patients have a history of hypertension or high blood pressure. Another really important point is that high blood pressure is a second leading cause of kidney failure, as well as a cause of vision loss and sexual dysfunction. So it's normal for blood pressure to go up and down throughout the day. It's really problematic when it stays high. Many times we have no idea that our blood pressure is high, and when it's severe hypertension, sometimes people can end up with headaches and vision problems, and sometimes blood pressure can get so high that it's a medical emergency. As I mentioned earlier, race can be a risk factor for high blood pressure, and African Americans are more likely to get high blood pressure. They often have more severe high blood pressure, and they're more likely to get the condition at a younger age. We don't really know why there are racial differences, but it's important to understand that that can be another risk factor that you should consider. High blood pressure means that blood is pushing too hard against your artery walls. The force of the blood can damage the delicate inner lining of your artery walls. One way to picture this is that your arteries are like a garden hose, and if you had really high water pressure inside your garden hose, it could make the hose hard and stiff, can cause damage on the inner lining of your blood vessels. If the inner lining is damaged, fat and calcium can build up in the artery wall, forming a plaque. This plaque makes the arteries stiff. This is also called hardening of the arteries. The plaque might narrow the artery. This narrowing can reduce the amount of blood that's flowing through the artery. Over time, plaque can cause problems throughout the body. The lower picture is a good example of plaque buildup in the arteries. If the arteries to the heart are affected, you can end up with coronary artery disease. A heart attack or abnormal heartbeats may happen as a result. If the arteries to the brain are affected, a stroke or a TIA might be the result. If arteries to other organs are affected, you can end up with such problems as kidney failure, peripheral artery disease, or even eye damage. Certain medications can raise your blood pressure. An example might be NSAID pain medications such as Motrin or ibuprofen. Tylenol in general or acetaminophen is less likely to raise your blood pressure. Other medicines that could raise your blood pressure might be amphetamines, oral birth control medication, to name a few. So you should always talk to your healthcare provider about starting, stopping, or changing any medications. Certain over-the-counter medicines like decongestants and cold medicines can also contribute to high blood pressure. So I would suggest if you need to take any over-the-counter medications, you should always check with the pharmacist or your doctor. Alcohol use should be kept to less than 1 drink a day for women and less than 2 a day for men. Avoid recreational drugs, and then caffeine should be kept to less than 2 or 3 cups a day, or you may even want to consider avoiding it altogether if you have high blood pressure. Your blood pressure can also rise if you're not very active. Certain elements in your diet are important for your overall health and including your blood pressure, such as eating enough fruits and vegetables and getting certain nutrients like potassium and calcium. Really, blood pressure can be one of many conditions that can be caused by poor diet choices. Many people find making lifestyle changes to be easiest if you start small and build on changes that over time can add up and improve your health. The next thing I'd like to discuss, and this is really the most important part of this whole discussion, is now what can you do to take control of your health? You can take your medicine on time every day. You can monitor your blood pressure at home so you understand and know how well it's being managed and whether you need changes to your medications or changes to your lifestyle to improve your management. Getting more exercise, managing your weight, and quitting any tobacco products if you use them, and then, of course, limiting alcohol, which we already discussed. So some things that you should discuss with your provider when you do see them is if you're having any concerns about medication side effects, any difficulty managing your weight, or quitting smoking, there are programs out there to help you, and I would suggest working closely with your doctor or provider to get the help you need. Another important point is lowering stress, and any of these changes, even small ones over time, will add up and are important to help you manage your health. So your blood pressure consists of 2 numbers. Systolic number, which is the top number, shows how hard the blood is pushing against the artery when the heart is pumping. And then the diastolic number, or the bottom number, shows how hard the blood is pushing against the artery when the heart is relaxed and actually filling up with blood. Both numbers are very important, and the American Heart Association suggests they should be 120 for the top number, 80 for the bottom number, or lower in order to maintain a healthy blood pressure. Sometimes, just from my experience, sometimes providers will slowly bring down blood pressure or have different goals for different patients, so it's just always important to work with your provider for your one-on-one care. Henry Ford Hospital's internal medicine clinic recommends checking with your provider for the best time of day to check your blood pressure. And in fact, they may recommend you check it more than once a day. Make sure you check your blood pressure 2 hours after taking your medication to get an accurate reading. You want to know if your medication's in fact lowering your blood pressure appropriately. Take your log to the doctor with you when you go if you're checking your blood pressure at home. It's good information to know if you're managing your blood pressure well, and it lets your doctor know if any adjustments might need to be made in your medicine. Also, you should bring your blood pressure monitor that you're using at home with you to the doctor's office when you go for your checkups. They can test your machine and see if it's accurate. So when you're checking your blood pressure at home, some really important tips to remember is empty your bladder first. You should find a comfortable spot to sit with your arm at heart level on a table. And you're supposed to sit still for 5 minutes and rest before you check your blood pressure. Try to keep your blood pressure cuff directly on skin and not over clothing. Breathe normally. Try not to talk. So the D.A.S.H diet stands for Dietary Approaches to Stop Hypertension, and it's a diet that's known to help people lower their blood pressure. And as indicated here, it's really a high fruit and vegetable diet. Whole grains, low-fat dairy, and 1 to 2 servings of protein a day, such as meat, poultry, and fish, nuts, seeds, and dry beans, and really limiting your sweets to 5 small servings a week. Remember, small changes can make a big difference. You should start with small, manageable goals and something you know you can accomplish, and then celebrate successes as you have them. Some tips and tricks that might help you make some diet changes might be planning your meals in advance, starting your meals with fruits and vegetables, and using spices and herbs instead of salt are some changes that you might want to consider to help you successfully manage your blood pressure. Many people think that eating a low-sodium diet means avoiding the salt shaker and not adding salt when cooking. And although that's true, most salt in the diet is actually in processed foods and prepackaged foods, and that's really where reading labels will help you determine where the sodium lies in your diet. That means you should avoid most foods that are sold in cans, boxes, jars, and bags. You should also eat in restaurants less often. There's many reasons to quit tobacco products, and high blood pressure is one of them. Quitting tobacco can improve the quality of your life, can save you money, and also save harm from those that you love from the secondhand smoke that you expose them to. And there are programs to help you when you're ready to quit. You can talk with your doctor and get help, and sometimes it takes more than one try to give up tobacco. Please don't give up. Physical activity is important for our overall health as well as keeping our blood pressure under control. Just like eating healthier, oftentimes you can be more successful if you make small changes and build your way up from there. Consider walking with a friend, finding a group class. Tracking your progress can be important to keep you motivated. And I think most importantly is do what you love. If you love it, you're going to enjoy it and stick with it. The next thing I'm going to talk about is medications. There are several types of medications and different classes of medications that your doctor may prescribe to control your blood pressure. Some of the possible side effects of diuretics or water pills might be increased urination or peeing more often, dizziness, dehydration, or an increase or decrease of some electrolytes such as potassium or sodium. Some examples of these diuretics might be furosemide, or Lasix is another name, hydrochlorothiazide, and the next class of medicines you may see used for treatment of blood pressure is beta blockers. How these work is they slow down the heartbeat and they allow the heart to pump with less force. Some examples of these type of medications are metoprolol and labetalol. Some common side effects of beta blockers might be drowsiness, fatigue, weakness, and impotence in men. If your doctor or nurse has prescribed blood pressure medicine, the most important thing you can do is to take it. If you notice that you get side effects that are worrisome or difficult to live with, don't just suddenly stop taking your medicine. Instead, you should talk to the prescriber about the problems that you're having. They may be able to lower your dose or switch you to another medicine. And if cost is a problem, you should mention that as well, because there's many times alternatives that are less costly. They may be able to switch you. So taking your blood pressure medicine can prevent you from having a heart attack or a stroke, and it can most certainly save your life. Some other types of medicines that may be used to manage blood pressure are ACE inhibitors. They work by blocking the formation of angiotensin II. One of the potential side effects of that can be a dry cough. And examples of that type of medicine is lisinopril and enalapril. ARBs, or angiotensin receptor blockers, relax blood vessels, and some examples of those might be Cozar, Diovan, or Benicar. And ARBs work also by blocking the action of angiotensin II, and they don't typically have any common side effects. The last group I will talk about is calcium channel blockers. It helps relax blood vessels. Some examples of that type of medicine are diltiazem or verapamil. And calcium channel blockers work by blocking calcium from entering the muscle cells of the heart and blood vessels. Some problems that some people may find they get taking these medicines is that it could cause you to feel tired, cause swelling of the abdomen, ankles, or feet, or edema is a medical term for swelling, heartburn, upset stomach, or constipation. So again, any medicine side effects should never stop a medicine without speaking with your doctor and getting their advice. They may need to change a dose or change a medicine to control your blood pressure and allow you to manage your side effects. So how do you stay on track? Some things that patients find helpful are using pill boxes or a medication schedule. They could associate taking their medicine with a certain activity every day, such as breakfast or bedtime, using an alarm on your phone, and also taking the medicine at the same time every day can be helpful to establish a habit and keep you regular with your medications. Keep a list of medications with you at all times, and you should always speak with your provider about what you should do if you miss a dose of medicine. If you have any questions or concerns, you should always check with your pharmacist or physician or provider to make sure that you're taking your medication safely and appropriately. Some healthy ways that you can manage stress. Some things might be meditation, yoga, walking, or being in nature. These things tend to make you feel good, bring down your stress levels, and managing your stress well, probably often overlooked, but very important in your overall health and definitely in managing your blood pressure. Some of the ways that I personally manage stress would be walking my dogs and even sitting on the floor and petting them and talking to them. They are very much a source of comfort for me, and they keep me exercising. The best thing to do is to figure out what works for you. Another important consideration is your sleep habits. Sleep, again, is another aspect of our lives that's underappreciated in how much it impacts our health. Keeping a consistent sleep schedule and limiting phone and screen time near bedtime can be helpful in getting adequate sleep. Meditation, as I mentioned previously, can be a very nice way to control stress and allow you to respond rather than react to situations and stressors in your life. I have suggested to patients to try YouTube and type in guided meditation. It will bring up many choices, varying lengths and types of meditation that you can do, and it guides you through. So if you've never done it and feel intimidated, it's a very nice way to be introduced and to utilize meditation. There's also many free apps you can download on your phone and lots of good tools for getting started. This concludes the high blood pressure information that I wanted to share with you today. The most important message I want to leave you with is that your health is in your control. If you are able to work on adopting healthy lifestyles, working with your doctor, and taking your medications, you can achieve good health. Thank you so much for your time.